Welcome. We are excited to introduce you to the Family Medicine Residency at Advocate Lutheran General Hospital. All inpatient rotations take place at Lutheran General Hospital. We run a family medicine service where we care for our clinic continuity patients. There's a good balance between education and volume exposure with patient caps in place per resident. Our dedicated family medicine workspace is on 6 South, where we have either desktop or laptop access with Dragon dictation capabilities. This area is also a space for residents to spend time together during the lunch hour or breaks. Our single-bed call rooms are all equipped with computers for easy EMR access. We have 4 hours of protected didactics time every Wednesday. Quarterly, we have simulation training focusing on various procedures and medical scenarios. Our pediatric inpatient training includes 6 weeks of working at the attached children's hospital. As a pediatric hub, residents routinely see pediatric patients with common and complex conditions. Throughout your residency, you will also care for newborn children in the hospital's nursery and rotate with many pediatric subspecialists in the inpatient and outpatient settings. Our residents receive a food allowance, and we have a cafeteria and Panera on site. There's also always coffee and snacks in the lounge. A fitness center is located in the hospital and is free for residents. Nesset Family Medicine is our outpatient continuity clinic, located across the street from the hospital, 0.2 miles away. Clinic time increases gradually with each year of residency. As an intern, you are in clinic 1 to 2 half days per week with 30 or 60-minute time slots. Each resident is given workspace in a larger office shared with co-residents to allow for camaraderie and support. We are fortunate to serve a culturally diverse patient population, exemplified by the fact that 55 different languages are spoken at the local high school. Our outpatient training provides the opportunity to perform multiple procedures, including suturing, skin biopsies, colposcopies, endometrial aspirations, IUD and Nexplanon insertions, joint injections, and fracture management, OMT, and point-of-care ultrasound. We have a multidisciplinary approach. Nesset resources include a care manager, behavioral health, radiology, lab services, pharmacist, nutrition, and in-house subspecialists. Our residents teach rotating medical students from 5 local medical schools. We are also fortunate to have a top-notch sports medicine fellowship and a world-renowned adult Down syndrome center as integral parts of our resident education. Our longitudinal geriatrics curriculum is at Central Baptist Village, a nearby nursing home. Our residents start in their first year and maintain continuity relationships throughout residency. They gain experiences with family meetings, discussions on goals of care and end-of-life care, and address common geriatric conditions. We recognize the importance of a balanced lifestyle, prioritizing resident well-being. Our team approach fosters a nurturing and collaborative environment. We believe that well-supported residents are better equipped to provide exceptional care for their patients and themselves. After 3 years, our residents graduate with superior skills and are ready to provide top-notch patient-centered care. We look forward to having you become an integral part of our close-knit group.